Hi, this is Debbie Fisher, and I'm here today to show you just some ideas of what you can do with your therapy scarves. So what you'll want to do is make sure that the scarf you're using is in a square, because it makes all the difference in the world. And just starting with the fingers, I'm sure a lot of you have done towel scrunches, but this is with a scarf. And what you can see with a scarf versus a towel is that you get a lot more repetitions. And you can also, in addition to working on finger flexion, you can easily work on finger extension. So you can do this with it just right in the middle, or if you're working on just thumb range of motion, you can place the scarf on the radial side and have the thumb and the index finger do most of the work. So you're really getting that thumb to extend. Or if you're working on weakness from the ulnar side and wanted the pinky and ring finger to do most of the work, then you position it really wherever you want the range of motion to occur from. Again, in flexion as well as extension. With the slick tables that you would normally have in a clinic, if you're just working on flexion extension of the wrist or a radial ulnar deviation, sometimes even that little bit of range of motion is painful. But if you just have them relax their hand on the table and have them use the scarf to kind of resist any type of friction, then you can have them do it in a teeny tiny little bitty, almost like a trimmer motions. I'm doing radial ulnar deviation, and then having him do it in full radial ulnar deviation. But just that little trimmer like motion over a couple of minutes can really kind of help loosen up the tissue to go into full range. Same thing with flexion extension. You can use it just to help reduce friction, doing it in teeny tiny, and then alternating between large and small. And those are just some of the ideas that you can do using on the tabletop using scarves. Here's some ideas of how you can use a therapy scarf for your fingers, wrist, and elbow. So what you can do if you're working on adduction, abduction of the fingers is just have them toss and catch it between each of the digits. So if you can't really see it, but I'm going between each one of them here. Or you can work on thumb opposition. So it's going to be thumb and index, thumb and middle, thumb and ring, and thumb and little. And you can add as much motion as you want to with that from the other joints. And then you can think about just the wrist. When I turn to the side, and you can see I'm kind of isolating it to be just wrist, you can work on wrist flexion extension, or you can work on supination, throwing it in supination, catching it in pronation, either doing that repetitively or just having it work just on pronation and wrist flexion and extension. So either way, just pronation, just supination, which is a little bit more challenging. Another thing you can do is to work on your shoulder, of course, any kind of shoulder or just elbow flexion extension here, and then working on shoulder flexion extension, shoulder abduction. And then now we'll go into a little bit more fun activities with the scarves. Now what we're going to do is I'm going to show you some fun activities that are also functional that you can use a therapy scarf with. So as therapists, we do work on activities of daily living. So although this may seem a little silly, it's really a lot of fun for your patients, and it's functional. So one of the things we have to work on is just something as simple as bringing your hands behind your back, to help fasten your pants, or even to put your bra on. You can have them do something where you're coming behind, just like this here, or you can do something where it involves more of the lower extremity. So like toileting, because you have to really reach underneath. You can do this with just one, or if you really want them to squat a little longer, then you can add 2 scarves. So now doing the same activity, they have to switch the scarves in each hand, and you can have them do it up as well as down, and then alternate the side here where they're switching the scarf. And a lot of times your patients will have a lot of fun doing this if you don't tell them you're working on toileting. Same thing with using one scarf and just having them squat and come all the way up. Squatting here, coming up, doing it with one, or if you want them to sustain the motion, using 2. So here I'm having them switch the scarves all the way up and all the way down. And those are just some other activities you can do with the scarves. Now I'm going to show you some different activities you can do with a therapy scarf that work on balance. Now, some of your patients may have great balance, so this would be a good challenge the way I'm showing it. But then other patients who don't have as good a balance, you can do this in sitting, and you can even do this in supine while they're in bed. So basically all you're having them do is just having them balance on one foot at a time when they go underneath the leg. And of course, if you have this to music, it makes it a little bit more fun. But just visualize doing this in a seated position or in a lying position, then you're kind of working on heel slides. So you can do it just standing here, or another advanced move would be to actually take a step forward and lunge and come back up. Taking a step forward and lunging, coming back up. Or you can have them do it where they have to take a step back. So this is more advanced, but this is really good for a physical therapist or whoever is working on the balance component. Another activity that you can do with the therapy scarves is to tie them together in a nice loose knot and just simulate like they're putting on a shirt. And this would be much easier than a shirt, but this is a great way to grade your activity. Or pulling off your pants. Same thing going back on is stepping into the hoop. It's nice because they're very bright in color and they're visual, so that if they do have a visual deficit, then that makes it easier for them. And you can always turn it in. You can always double it over if you want to do something just over their head and back over it that way. Here's some pre-juggling activities you can do with your clients. Just always remember that you want them to grab the therapy scarves right in the middle, because that way when they toss it, it's going to give it more time for it to come down. So you could, like I showed before, you could do just one hand, which again, this is so non-threatening. If you have someone coming in with a lot of pain and guarding, this is a nice activity to start with. But if it's a neurological patient, it is good to be doing some coupling, and that's just doing symmetrical work with the scarves. So just having them do it together here, either in flexion, shoulder flexion, or in abduction, this works on proprioception, or even kind of more into scaption. You can do it together, or you can work on alternating movements, just like this here, and then do simple PNF patterns, where you're having them cross it, just across their body. And those are just some pre-juggling activities you can have them do. Now we're going to use the therapy scarves to juggle. I know that may sound a little funny, but think about juggling. You're crossing midline and you're working on doing multitasking, releasing and catching at the same time. So this is a great cognitive challenge. I love to give this to patients that have had Parkinson's, just to work on that explosive big movements too. So you can use this for many different populations. So when you do juggling, you do want to just teach them again to always make sure and grab from the center of the scarf. And then it's always good to get a good base of support so that they don't fall. And if they have any balance problems, you can certainly do this with them sitting or even lying in bed. So you would have them take the first scarf, you're going to have them bring it all the way down to their side. And when you tell them to bring it across their body into that PNF pattern, you don't want them to release until it's literally right above the shoulder. And you really want them to aim to the ceiling. So I even try to have them squat some so they can use their entire body to give them the momentum to get high enough. Because the higher that you throw the scarf, the more time you have to process different sequencing patterns. So again, I'm going directly diagonal across my body, not in any kind of an arch. So just watch me how I squat. I go across my body as high as I can to give my left side a chance to catch it. Same thing with the other side. So this would be the first activity you have them do, whether it's for 1 minute, 2 minutes, but just to make sure they really have good balance and that they can process the first activity for juggling. Then what you can do is have them practice with 2 scarves. So here, what you're going to have them do is you're going to have them release in a diagonal for the first, and then release when they get above the shoulder of the right arm, and then you're going to have them catch it without crossing midline. So watch what I'm talking about. You're going to have them squat, toss, toss, catch, catch. A lot of people, when you first teach them this, they want to cross, 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 cross. But you can see how that's much more challenging. So visualize an X and then a number 11. So here's your X and there's your 11. So it's a toss, toss, catch, catch, or you can say crisscross applesauce. Anything just to kind of make them laugh and have fun with the activity too. So once they've gotten the pattern where they've done a cross, cross, catch, catch, then you can add 3. And it may sound challenging if you've never juggled before, but with scarves, this is actually it's not a difficult activity if you're doing it correctly. So what you would want them to do is to take one scarf to the little finger and to the ring finger, so digits 4 and 5, and then the other scarf, have them place it in the first 3 digits of their dominant hand. And then you're going to place the second scarf or the third scarf in the opposite hand. So all I'm going to do is I'm going to toss the one that's in the first 3 digits of the right hand and then toss the one in my left hand. Now before I can toss the third one, I have to catch the first one. So watch real closely when I do this and we'll break it down. So you're going to have them toss, toss, catch the original, and then toss the third. And if you can see this, this is just repeated X's, just like that. Now what you'll find is that instead of maintaining crossing midline above the shoulder, some people will start going in front of them, and this gets very confusing. So it's important to really emphasize going to either diagonal. And that is how to juggle with 3 scarves.